Breaking news now coming in. As expected, we're getting some news that Cipla may have got the approval for Moderna import in India. A source to PTI has said that Cipla has got the DCGI nod to import Moderna's COVID-19 vaccine for restricted emergency use in India. Runjan Sharma is also joining us. So Runjan, this is on expected lines. We were hearing the approval could come today itself. This shows the intent that the government wants to expedite this as soon as possible.
Yes, we were just talking about it, like you mentioned, Shivani. The government has been wanting to fast-track the process as far as getting more vaccines, foreign vaccines as well, into the country. Now, the big question will remain after the Drug Controller General nod to import Moderna. In fact, remember yesterday, Cipla had sought the nod of the Drug Controller General of India. Today itself, DCGI has given a nod to import Moderna's COVID-19 vaccine for restricted emergency use in India. The big question now is how many doses of Moderna will be imported to India? What would the pricing be? Will it be a part of the national vaccine policy as Covishield and Covaxin are currently? Will it be administered in both government as well as private hospitals, or will it just be in the private hospitals, administered just in the private hospitals? These are some of the details that we will have to look out for. Remember, Moderna, again, it has good efficacy. It has to be the storage, as far as the storage is concerned, sub-zero temperatures again, and which is why the assumption really is that it would be available in urban India more than rural India. But some of these details, very, very important details, is what we need to watch out for, Shivani.
Right. Let's also focus on the Moderna jab itself, Runjan. Of course, it has been one of the top ones that have been used in many Western countries. But it is a smaller company, as they say, right? It's much smaller than Pfizer. The question mark always was, how quickly can Moderna provide jabs to India? So we're looking at first, of course, perhaps on the Sputnik model. Are we looking at first the jabs to be only imported or later produced in India too?
Yes, these are some things that the government will have to work out on how it works best. Will it be imported first, or perhaps there could be a technological transfer as well? But how many doses? That really remains the big question. Because remember, Shivani, despite Sputnik V arrival in India a couple of months ago, despite 3 batches of Sputnik V that have come into India, despite 3 shipments, we've not seen a real rollout of Sputnik V on the ground. The batches have been small. It's been small batches of Sputnik V that have come into India. And that also now remain limited to, say, the Apollo chain, which is administering the vaccine currently. So these are some details that we will have to see if Moderna is able to give out a good bulk for India, because then it's going to make the real difference as far as the mass vaccination in the country is concerned. Yes, it's great news because we'll have one more vaccine now and a good one on top of that in India very soon, hopefully. But the question really remains that will it be an integral part as far as the vaccination drive is concerned? Will it be available in good quantity? Will it be able will it be available in both private as well as government hospitals? That is something that is going to be the big question. But of course, it is a good news that the Drug Controller General of India has now given its nod to Cipla to start importing Moderna vaccine into the country, Shivani.
Yes, the government has, of course, on many occasions reiterated that they want to expedite this. There are, of course, indemnity clause issues with these vaccines, like the ones from Moderna, Runjun, and, of course, the one from Pfizer. And they've also faced some criticism at how, this has taken longer than what many people would have liked. But now that it is finally done, let's also look at the vaccine in itself. How well has Moderna done after, as far as its clinical studies are concerned, and of course, after rollout in several countries? Runjan, can you hear me?
Yes, Shivani. In fact, Moderna has been one of the top 2 vaccines that have been administered across the country. It got huge demand, not just from from India here, but countries all over the world have been eyeing both these vaccines, Moderna as well as Pfizer. Now, the timeline that we were given by the government of India was hoping that Moderna would come into the country somewhere in 2022. This is good news that it already has got an approval, has got a nod from the Drug Controller General of India. Remember, only yesterday, Cipla had approached DCGI for their nod for importing the Moderna vaccine into the country. It's got a nod now. It's a good vaccine. It's got good efficacy. Remember, Shivani, this vaccine, like I pointed out, is, the world is really eyeing for the vaccine. And now the hope really is that soon India will get another vaccine. And, more the vaccines, better it is for us. But again, like I said, will it be a part of the national vaccine policy? Will it be procured by the government and then given out to states, the 75% quota, as it's been done currently for both Covishield and Covaxin? That's something that we will have to see. Will it be administered only in private hospitals first? Remember, I pointed out, Shivani, that the vaccine has to be stored in sub-zero temperatures, and which is why it does make it difficult to send out the vaccine in interiors, in rural part of the country. So will it be limited to the urban part of the country? These are some details, and hopefully we'll have more answers to it from in an hour's time from now, because that very important health ministry briefing, also remember, is today at 4 p.m.
Yes, we will look for more clarity on this and anything more that they can add. Dr. Snajeev Bagai of the Nephron Clinic is also joining us. Mr. Bagai, we are learning that the DCGI has given its approval to Cipla to start importing the Moderna jab. Your first comments.
It's absolutely encouraging. It's heartwarming, because we know now we have another weapon in our armory to fight this infection. We already have 3, which is Covishield, Covaxin, and Sputnik, which is being used in the Indian diaspora. So this will be the 4th. And as the Health Ministry and the Vaccine Advisory Body through Dr. V.K. Paul has already mentioned, in another 1 or 2 months, we will have a total of 8 to 9 platforms. So with Moderna coming in and with Zydus Cadila just about to be sanctioned, we know the intranasal is there, BioE is there, Pfizer is also applying. So I think it looks extremely promising. I have no reason to doubt that by end of December, we will reach a magical figure of 180 to 190 crore injections. As per yesterday night at 8 p.m., we finished 32.85 crores, which is a huge number, gauging by the length and breadth of our country. And we know that 135 crores are going to be more from August onwards. So I'm pretty sure that we will reach this figure. In the meantime, there are 2 simple messages for every person listening to this program: vax up and mask up.
Absolutely. We'll have to wait and see exactly what are the numbers that Moderna can provide, because, of course, these are jabs that are being used across the world. They are in great demand and less supply. Moderna also not being as big as Pfizer when it comes to its capacities. But Dr. Bagai, I thank you for joining me for the meantime. We're looking at Moderna getting this approval from the DCGI, and that of course means that technically speaking, we have 4 vaccines that are now approved for emergency authorization in India. There's of course the 2 ones that are being produced in India. There's of course Sputnik that has been imported, will eventually be produced in India, and now Moderna that the deck has been cleared for its import as well.